So you got a disc herniation. This is the disc. Inside we've got the jelly. So if we're examining our Tim Hortons disc here, this would effectively be the disc that you're seeing here. So you've got all those discs that live inside the spine here in between the vertebrae. So watch last week's video if you want to find out more about a disc herniation versus disc bulge. But this one we're talking all about what are the signs and symptoms that you might experience if you've got it going on. Important thing to note, typically it's going to happen in the neck or in the low back. Generally not going to happen in the mid back. It's possible, but it's very rare. So, Scott, what can happen in the neck and where might you feel it if it's painful?
Well, it can happen in the cervical spine. It can affect your fingers, predominantly these 3 fingers or these 2. It can cause some sharp shooting pain, some numbness, some tingling, or even decreased sensation.
Yep, but not all the time, which is interesting.
Yep.
So some people just experience intense localized neck pain. Sometimes it will travel in the shoulder. Sometimes it will go into the arm. And sometimes it will go right into the fingers. And like Scott said, sometimes you'll have some numbness, tingling, and in some cases you may have weakness as well. Exact same thing is true for the low back, but different area. So you might experience that low back pain locally. It could be very intense. Or you might find it travels down the buttock. Could go the back of the leg, which is the most common, down below the knee into the calf, and at times into the foot. You might also find that you experience numbness and tingling and a foot drop or some weakness in the foot. So you might find when you're walking, you just feel like there's not a whole lot of control, not a whole lot of oomph in that foot. So those are typically the most common things that you're going to experience with a symptomatic disc. Now, important thing to note is lots of other things can create those same patterns, what makes it extremely tricky. A sacroiliac joint, one of the big joints of the hip here, can travel down into the leg. Soft tissues can travel down into the leg. The facet joints, which are these guys, can travel down into the leg. And even if we're looking up here, referral patterns from the joints in the neck can travel into the shoulder blade, into the middle of the back, down into the arm. Tissues around the shoulder and the neck can travel down into the hands and even create numbness, tingling. So important thing to note is those are some of the things that can happen with a disc, but it's not always a disc problem if you experience that. So important thing is get checked. Have a professional assess you properly to understand what's happening to the best of their ability. That way they can give you the care that's going to be best suited for you. So stay tuned for next week's where we're going to tackle some really great exercises, some home care, self-care things that you can do if you're experiencing some of that nasty stuff to calm down that angry disc. Have a great day, and we'll talk to you soon.
See ya.